This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
All right, good day. Welcome, everyone, to the latest edition of the Best Health Podcast. I'm Justin Gomez with Wake Forest Baptist Health, and I want to thank everyone for listening out there. So this podcast is a continuation of this mini-series of podcasts that we've been doing, just surrounding the overarching topic of coronavirus and COVID-19 and the impact on our lives during this season. And we have another great guest joining us today, and he's going to talk a lot about the infectious disease aspect of being pregnant during this time period, and that is Dr. Phillip Heine. He's the chair of obstetrics and gynecology here at Wake Forest Baptist Health. So welcome, Dr. Heine. How's it going?
It's great. Great to be here. Thanks for having me.
No, thank you. Thank you. I know you all have been extremely busy at the medical center, so thank you for taking time to be with us. And I think it's an important topic. I've seen, like a good amount of people talking about it on social media and just kind of maybe some different questions they had. So hopefully we'll be able to answer some of those questions today. But before we get started, Doc, would you mind just telling our listeners a little bit about yourself?
Well, I am, as you said, I'm the chair of the Department of OBGYN. My clinical expertise is within maternal fetal medicine or high-risk pregnancies. And my area of interest is infectious diseases within pregnancy. So this question regarding COVID-19 and its impact on pregnancy is one that certainly interests me. Sure.
And I'm sure you and some of your colleagues have been talking a lot about this and reading various documents lately, and we appreciate you being able to offer some insight. I do want to say, just before we dive in, at the top of this episode, like I've done at the previous episodes, for anyone listening, if you have general questions about COVID-19 or the resources that Wake Forest Baptist Health has about coronavirus, you are more than welcome to go to wakehealth.edu/coronavirus. And all of these podcasts are listed there, but a ton of other great resources and information about clinic updates, visitor restriction updates, just different ways and information that you can keep you and your family safe. So invite everyone to check out that website for information. So Dr. Heine, I know you've been practicing for years and years, and we're excited to have you at Wake Forest Baptist Health as the chair now. So one of the questions, just as a kind of a good baseline question that I've seen a couple of times out there on social media, is just are pregnant women at a higher risk for COVID-19? And I guess kind of as a 1B follow-up to that question, if a pregnant woman does test positive for COVID-19, are they at an increased illness for becoming very severe and having to be hospitalized?
It is the question on everybody's mind. The question's on everybody's mind.
Mm-hmm.
However, with the limited data we have, we actually are reassured. It does not look like pregnant women are at higher risk of attaining COVID virus, have probably the same risk as the general population. And although it's limited, the data in pregnancy, it's probably not any more severe than somebody else of that age group who has COVID virus. Now we take that with a grain of salt because many viral infections, viral respiratory infections, especially in the later part of pregnancy, there's more severe disease. So certainly we need more data, but as it stands right now, it looks like that pregnant women are at not greater risk with COVID virus.
Okay, well, we'll take that. So if someone out there that's listening that is pregnant, or they have a relative or a friend that's pregnant, what advice would you give them on how to protect themselves from coronavirus, from COVID-19?
Well, I think it's what most folks are doing is that if you can avoid exposure to the virus, you will not get the virus. And so if you at all can, please stay at home. And if you do need to travel or you do need to work in this environment, you need to practice social distancing, stay 6 feet away from folks. And then you probably also, the new recommendation is wear a mask. And so I would follow that recommendation, whether pregnant or not. And I think it's important to note that not just for the pregnant patient, but for those who are around her. Because if she has other children and her spouse, if they go out and get exposed, they can give her the disease that way. So I think for the family, best to try to avoid exposure. That's the best way to do things.
Yeah, that's a great point about the family and everyone that is in the household with her. So if someone is pregnant and they start experiencing symptoms of a respiratory illness, and we've seen a lot of the main symptoms out there. They're on our wakehealth.edu/coronavirus website as well. If they start experiencing symptoms of respiratory illness, what would you recommend they do before they kind of get into super stress or panic mode necessarily?
Well, I would recommend that they call their physician's office and just review their symptoms with their physician. What's going to happen is if they have significant symptoms, say they're really short of breath, or they have chest pain, or they're having symptoms of dehydration, such as dizziness when they're standing up, or if the provider on the other end feels like they're not making much sense as they're talking to them, they're going to tell them to come in and be evaluated if they have those significant symptoms. But if they tell them that they just have a low-grade temperature and they feel like they have a little bit of the flu, what the provider is likely going to tell them is just to treat their symptoms and stay at home and quarantine themselves for probably 7 days after the symptoms came on, and at least 72 hours of having no temperature.
Okay.
So that would probably be the recommendation, is just kind of assess the level of the symptoms and review those with your provider.
Sure. Now, I guess I want to back up. That's if they're experiencing symptoms of respiratory illness. But as most people listening know, if there is a woman that is pregnant, she has to go to her physician, her OB, ever so often throughout the course of the pregnancy. And what would you say to pregnant women about their regular doctor's visits outside of any illness right now?
Well, I think it's important that they go to their regular doctor's visits because that obviously we can't defer care in this setting of pregnancy. So I think they need to go for their regular doctor's visits. But I think that offices now are screening patients, screening everybody that's coming in with patients to make sure that they limit exposures of pregnant patients who are coming in for visits, as well as the staff who are getting exposed to those patients. So we're taking every precaution to try to limit what exposures both patients and our providers will have during those visits.
Yeah, that makes great sense, Dr. Heine. And this is another question that I've seen a couple of times on social media as well. Should a woman at some point test positive that is pregnant for COVID-19, can it be passed on to her unborn child?
The data we have on that out of China looks like if a mom is sick around delivery, it is going to be very rare that it is transmitted to the child at that point in time. However, we don't really have data during the pregnancy on if a mom is sick early or mid-pregnancy, whether they can transmit it to the baby. I'm going to say with other viruses in its family, as well as many other viruses that can infect pregnant women, the vast majority of the time, it does not transmit to the baby. And even if it does, the vast majority of the time, it doesn't cause any problem.
Okay, interesting. So almost as a follow-up to that question as well, right after the child is born, most women will start nursing. So what have you heard or seen or read about the coronavirus being passed on through breast milk if for nursing mothers?
Well, if it does not appear to be in breast milk, so we don't think that's a mode of transmission. And even if a mother was coronavirus positive, if she had COVID-19 and she delivered, the new recommendation is that we separate the baby. However, the mom should continue to pump and we should breastfeed the baby with her milk, because breast milk is like medicine for a newborn.
Okay.
It has many benefits, and one of its many benefits is it lowers the risk of acquiring a viral respiratory infection. So, yes, we still recommend breastfeeding even in the setting of a mother being positive for COVID at delivery.
Okay. So as a mother, a pregnant, expectant mom is moving along and getting close to delivery, the big day. What are some recommendations or what advice could you give as her trips to the doctor's office pick up in frequency and maybe for whatever reason she has to go to the hospital at some point and she thinks that she's starting labor. What are some of the best strategies for avoiding COVID-19 for moms or expectant mothers?
Well, I think if they're coming to the hospital and they're in labor, I think, obviously we can't stay at home and avoid everything in this situation. So we're going to have to come to the hospital, but one can still practice social distancing as you're making that journey. Mm-hmm. And as you come up to labor or into the hospital, they're going to be screened at the front to make sure that either they or their partner has no symptoms of COVID infection. Mm-hmm. If the mother is in labor and has symptoms, she will still be brought up to labor and delivery, but we'll take her to rooms that are designated for folks with COVID infections. Now, all of our patients now that come in labor are going to be isolated in that room, mm-hmm. And will be limited to one healthy visitor. Mm-hmm. If it's a COVID positive patient, they are not going to be allowed a visitor in that situation, just because they could transmit disease. Mm-hmm. So we are really trying to make the experience as safe as possible at Wake Forest Baptist.
Yeah, so that was kind of my next question leading into it is, just based on there's a seemingly 24-hour news cycle about coronavirus and all the different things that are coming out of the media about, possible exposure and what that can do. It reasonably gives some people some anxiety or heightened stress. But your leadership and your team around you've taken every measure to make sure that a mom is going to be welcomed and well taken care of in a very safe environment when it's time to deliver the baby, correct?
And that's absolutely correct. We really want to limit exposure of our patients and as well as our providers. So even when our patients come in, they're going to be in that room for their delivery process. And the providers that are going to be taking care of them are going to be using the protective equipment on every visit. And so we're going to really limit their exposure or even potential exposure to COVID virus.
Sure. And it's, I'm assuming this is business as usual in our new labor and delivery section of the hospital. And what I mean by that is a mom, you have the full resources and capabilities of any scenario that could come up if a mom is giving birth naturally or if a C-section needs to happen. You all are prepared to take care of all of that per usual, correct?
Yes, that is correct. We've gone through scenarios where mom potentially has COVID or other things, and so we feel like we're well prepared for what can occur.
Great, great. And just, we're getting ready to wrap up here, Dr. Heine. I thank you once again for taking time out of your day to talk to us about, being pregnant and during this COVID-19 crisis in our country and in our area. As a physician who's been practicing for many years, if you just want to give me, kind of your insights off the top of your head about, have you experienced anything kind of like this in the past, or especially in the OBGYN world, that we're kind of going through now with social distancing and just the rate at all the precautions that are being taken? I just would be interested to hear your standpoint, given your many years of experience in medicine.
You're making me feel old today, but I've never been involved with anything quite like it. I'm going to say that the closest thing I would say in my career was the H1N1 flu of 2009,
Gotcha.
which we had similar concerns about, and had the interesting thing about H1N1 was that it did have an increased risk in pregnancy. So pregnant women were had worse outcomes with H1N1,
Okay.
but it wasn't as widespread as what we've seen with COVID. But that's about the only thing that I can remember that was even close, and that doesn't pale in comparison to this.
So, Dr. Heine, thanks for being with us again today. If you want to offer any other final thoughts or advice about specifically pregnant or expectant mothers and COVID-19, just anything else that you've heard people asking about lately?
The one thing I would like to touch on is medical treatments in pregnancy in patients with COVID.
Okay.
I want to stress that we really don't have a treatment beyond supportive care at present. However, there are a bunch of treatments that are under investigation, including one that people have heard about, chloroquine and hydroxychloroquine.
Mm-hmm.
But there are others also under investigation. And the good news is the vast majority of these have been utilized in pregnancy and are completely fine to be used in pregnancy. And if they're found to be beneficial, then it is likely that we can use them in a pregnant patient that's ill.
I appreciate you offering some insight there, and thank you for taking the time. If any of our listeners listening to this episode have any questions about the birth center or needing to see an OBGYN, you can just call our general WAKE number, 336-716-WAKE. You can also go to our website, wakehealth.edu, and search birth center, and you'll see all the available resources that we have for expectant moms there. And if anyone has any questions specifically about COVID-19, like I said earlier, they can go to the wakehealth.edu/coronavirus URL, or they can call 336-70-COVID, and someone will be more than happy to talk with them. So Dr. Heine, thank you so much. I know you're busy, but I appreciate you offering this really good information for expectant moms and people in the circle of influence of expectant moms, be it the other parent or siblings or their family members or friends. So this has been great information, and we appreciate you taking the time, sir.
Thank you for having me.
Absolutely. So thanks everyone for listening. You can download any of our Best Health podcasts anywhere you find your podcast on your smart device, or on our website as well. So until we chat next time, I hope everyone can be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.